Let's dive right into this explainer. Today, we're unpacking a highly credible, evidence-based framework designed for systemic quality improvement in healthcare. It's called the SA-OHL-Thai. Now, if you're a hospital administrator or healthcare executive, you know that delivering excellent clinical care is really only half the mandate, right? The other half is ensuring that your patients actually systematically understand the care they're receiving. So we're going to explore how this academic self-assessment guideline allows healthcare facilities to diagnose their communication systems and actually close those critical organizational development gaps. So let's start with a really big question. Is health literacy solely the patient's responsibility? For decades, the medical community kind of just assumed that if a patient failed to follow post-op instructions, well, that was a failure of their own comprehension. But we really have to ask ourselves, is it a patient's failure, or is it a failure of the healthcare system that handed them impenetrable medical jargon in a high-stress environment? This brings us to a massive paradigm shift. We're moving away from personal health literacy, or PHL, and shifting our focus to organizational health literacy, known as OHL. Instead of scrutinizing an individual's ability to somehow navigate an overly complex system, the spotlight is now on the healthcare system itself. The institution bears the systemic responsibility to make health information accessible, understandable, and completely actionable. To break all this down, here's our agenda for today. First, a new health literacy paradigm. Second, the global evolution of assessment tools. Third, the 7 assessment categories. Fourth, leveraging the digital application. Fifth, closing organizational development gaps. And finally, measuring ultimate health outcomes. Kicking things off with Section 1, a new health literacy paradigm, moving from the individual to the system. Moving right along to Section 2, the global evolution of assessment tools and how we build on that evidence. The SA-OHL-Thai framework didn't just appear out of nowhere. It is the result of rigorous international research. It really started back in 2012 when the U.S. Institute of Medicine established the 10 attributes of a health-literate healthcare organization. From there, Europe took the baton and developed the Vienna Health Literate Organization model, expanding it to 9 standards. And then by 2018, Thailand's Health Literacy Association adapted these global gold standards into a highly targeted tool. It was specifically designed to give administrators decisive, systemic control across 4 distinct healthcare settings. Think of it like this. It's a perfect macro analogy. Just as a patient might plug their data into a smartphone app to track habits and get personal risk assessments, hospital executives can use these digital organizational self-assessments to diagnose institutional weaknesses. You are essentially applying a total quality management model directly to the entire macroorganism of a hospital. Next up is Section 3, the 7 assessment categories. This is really the core engine of the framework. So the framework maps out 7 distinct categories. Within those, you have 20 items and 62 highly rigorous indicators, providing a comprehensive blueprint for administrators. And let me be clear, this extends way beyond just printing better brochures. It asks the tough questions. Is leadership actively driving a culture of clarity? Are your communication materials actually co-designed with patients? It measures workforce training to make sure every single staff member is equipped to communicate effectively throughout the entire life cycle of a patient's interaction with your healthcare processes. And here's a highly proactive detail in the process and workforce categories that absolutely changes the game. Miscommunication is treated as a literal adverse event. It requires formal risk management and staff training. If a patient doesn't understand their discharge instructions, this framework categorizes that with the exact same severity as a clinical error. It literally forces facilities to implement universal design in their physical spaces, think clear, intuitive signage, and it mandates that staff use the teach-back method, where they ask patients to repeat instructions back in their own words to verify true comprehension. Let's dive into Section 4, leveraging the digital application, known as the V-HLO network. So how do you actually measure all of this? Through the digital app, hospitals systematically score their performance across those 62 indicators. But instead of a simple binary yes or no checkbox, you use a highly nuanced 4-level rating system. For example, if you achieve 0 to 25% completion on an indicator, that's a level 1 score, which carries a statistical weight of 0.14. But hit 76 to 100% completion, and you score a level 4. This weighted data then aggregates into incredibly comprehensive diagnostics for your administrative team. Which leads us perfectly into Section 5, closing organizational development gaps, or finding the OFI. Imagine you're looking at your facility's data visually. It instantly highlights the disparity between your current strengths and your developmental weaknesses. An administrator might look at this and say, okay, our leadership score is robust, but our customer involvement score is lagging at 60%. That remaining 40%, that is highly actionable data. It points precisely to systemic failures in how you're communicating with your community. We call that 40% gap an opportunity for improvement, or an OFI. Identifying these OFIs is what allows healthcare leaders to implement targeted measures on a 3 to 6 month cycle. This could mean launching a specific project to translate all your consent forms into plain language, or maybe doing a training blitz on chunk and check communication methods for your clinical staff. And then, following that intervention, the facility reassesses to systematically measure that gap actually closing over time.
Finally, Section 6, measuring ultimate health outcomes and looking at the final impact.
So what's the ultimate payoff here? By successfully executing these self-assessments and closing those organizational gaps, hospitals achieve some absolutely vital outcomes. We're talking reduced costs, empowered patients, and fundamentally better health behaviors. Drawing on Sorensen's health literacy framework, we know that closing these organizational gaps leads directly to higher success rates in healthy behaviors, simply because patients finally comprehend their care plans. It also slashes operational costs by preventing readmissions caused by miscommunication. And on a broader societal level, it empowers vulnerable populations, bridging the equity gap and ensuring everyone, regardless of their background, can navigate the healthcare system safely. The evidence-based frameworks are here, and the digital self-assessment applications are fully developed and ready for deployment. But it all comes down to one ultimate question. Is your facility truly ready to take systemic responsibility for patient understanding? Is your leadership team prepared to stop blaming the patient, embrace systemic accountability, and become a truly health-literate organization?